attending school, particularly due to anxiety or depression. Just by way of introduction, and I appreciate the introductions given so far, but I'm speaking from a lens of having in a former life run an intensive cognitive behavioral therapy program at Mass General for teens with severe anxiety disorders, many of whom, in fact, a large majority of whom had trouble with consistent school attendance. So I'm going to be referencing some of that work today as we think about how we can improve the treatments that are available for these teens. But in addition, in my practice here in Concord, the Concord Center, we often see adolescents who struggle with school attendance. And as you can imagine, that problem has become even more complicated over the past year plus with the pandemic and remote schooling and changes in routine. So we'll be talking about that as well, or at least referencing it today. So without further ado, there we go. So this is my first opportunity to speak to a really broad audience about this topic. I'm accustomed to talking to mental health professionals about school avoidance. So I did my best to make it applicable to the broad audience by at least first going over what we know about adolescents who avoid school. And I'll start with that and then talk a lot about the risk factors that we see coming up for kids who avoid school that we want to be addressing within treatment. From that point, I'll describe the treatments that are available for this population, and in particular, how we can individualize the treatment to improve outcomes and improve school attendance in particular. And as I imagine, we probably have a lot of parents who've joined us today. I'm going to be going over 2 empirically supported parenting strategies that can be very useful for working with teens who have problems attending school, and then how best we can collaborate with schools to create a solid, supportive foundation for our adolescents. So let's start with an understanding of what school avoidance is. It's often referred to as school refusal. I don't love that term because it's often associated with defiance or oppositionality. And many of the kids that I've seen in my practice very much want to be able to attend school, but find it incredibly daunting. So avoidance makes a lot more sense to me. School refusal, though, as an umbrella term, can refer to the motivated avoidance to attend school or difficulties remaining in school for an entire day. And it's often associated with high levels of distress, anxiety, and depression. That said, because it is such a broad term, it can encompass kids who don't want to go to school for other reasons, whether they would prefer to be doing things with friends or they're engaging in truancy. So it's a heterogeneous behavior. And there certainly is an overlap with so-called acting out problems or behavioral problems, even among adolescents who have anxiety or depression. When looking at the prevalence of school avoidance, approximately 2 to 5% of school-aged kids and teens avoid. And so I say that knowing that it can be very difficult to quantify how many teens and kids are actually avoiding school, because schools vary quite a bit in the degree to which they capture, say, partial absences or full day absences. And so many kids who avoid school might be marked there, present for the day, but then leave early or have their parent pick them up. There are anecdotal reports, and we don't have any actual research papers yet to quantify, but at least there's some evidence that there are kids who have been avoiding more and more since the start of the COVID-19 pandemic. And that would be in association with the very well documented mental health crisis that we're experiencing among adolescents. So as rates of anxiety and depression have skyrocketed, so too has avoidance of school, whether it's online or in person. And you can only imagine for some of these kids who really depend on having the routine of being in school every day, the hybrid model in particular was quite challenging, having to mix things up day to day and feel like you're facing the challenges of actually showing up in school anew with so few opportunities to practice. I'm hopeful that that will improve as kids are back in school. And as you know, in Massachusetts, the high schoolers have gone back if they wish this past week, I believe. Um, what's interesting is that though there are differences across gender in rates of anxiety or depression, there is not a significant difference in prevalence of school avoidance between boys and girls. There's what's called a bimodal distribution of onset of school avoidance. What that means is that there's two different peak ages where you tend to see school avoidance begin. There's the 5 to 6-year-olds who are starting kindergarten, going into first grade, and may struggle with separation anxiety or being in a brand new environment away from home. But then you have a middle school aged group who starts to struggle as well. And as you imagine, that might be more related to challenges academically or with their peers. What we do know is that regardless of when the school avoidance begins, it can often develop into a chronic issue over time. So it's not unusual for me to evaluate an adolescent who isn't going to school and to find out that when they're in second grade, say, they had some struggles getting into school. It tends to be one of those problems that either persists or comes and goes. And as we'll be talking about, we know that school avoidance co-occurs with a wide range of mood, anxiety, and disruptive behavior problems. And we also know that unfortunately, chronic school avoidance has a great deal of impairment, both for kids and their families. In the short term, as you might imagine, if a kid is not in school, they're having a lot of trouble maintaining their grades. They might either underachieve or not achieve to their abilities, or not be completing assignments and thus earning poorer grades, and then having to catch up later, which only increases their stress. In the short term, missing school can also make things difficult in peer groups, or getting back into social situations. It can lead to isolation of the teen and increased family conflict, as we'll be talking about more later. There's also the very real possibility of legal ramifications. As you know, kids who are 16 and younger, it's the law for them to be going to school. And I have had it happen where parents are reported to Department of Children and Families or even to the court system if their kid is not attending school. Not to be scary about that. And I should say that I've seen a decrease in that over the course of my practice, but it is possible that it could happen. And I think the ultimate goal there is to try to increase supports for families to help their children get into school. In the longer term, if kids persist in school avoidance, it can, as you imagine, limit higher educational opportunities. Teens might struggle to get into colleges because of pockets in their academic record. And that only leads to a cascade of other issues like lower earning potential, or possibly unemployment. You also have kids who are more likely to drop out of school early, and perhaps seek out their GED instead, or not. And then in other instances, in the long term, kids who refuse school have a higher risk for subsequent psychiatric disorders in adulthood, as well as increased risk of self-harm and suicidal ideation. So we want to take pause and recognize that there are some significant costs for this behavior, but the good news is we're going to be talking about today about how to offset some of those potential outcomes for these kids. Sorry, there we go. I kind of laugh when I get to the slide and giving a presentation because school avoidance is so heterogeneous that it practically encompasses all of the different types of anxiety and mood issues, as well as executive functioning problems. But I wanted to give you a handle on the kinds of issues that can come up for this population and what that might look like. And then later we'll be talking about how to individualize treatment for these different types of presentations. So a lot of teens who avoid school have social anxiety. They fear being evaluated both by teachers and their peers. They might have discomfort or anxiety in social interactions. So these are the kids who might keep to themselves, or else hang out with peers, but with a great deal of white knuckling, I like to call it, just kind of trying to grit their teeth and get through the day and try to present themselves as well as possible. These kids tend to dislike giving oral presentations or working in groups for fear of being judged negatively by their teachers and peers. We also have kids who present more with generalized anxiety. So these are the worriers. And worriers might be more likely to have high expectations for themselves or perfectionistic about their work performance. I work with a lot of kids who put tons of pressure on themselves to get excellent grades or to be perceived as having it all together. And that can lead to a lot of concern about making mistakes um, or people finding their work to not be as best as they could perform. So kids might avoid school for fear of disappointing others or not doing as well as they would like, um, or not doing as well in an extracurricular like a sport that they play, and it's just easier to avoid than facing those situations. Many teens, even middle school, high schoolers, can experience separation anxiety or worry about something bad happening to them or their families when they're separated. Worries about something happening to a parent when they're not with them, for example, as well as many teens experience phobias that might make it difficult for them to attend school. So younger kids might be more likely to fear fire drills or loud noises. Other kids might fear the bus for one reason or another. I've seen many teens over time who have a specific fear of vomiting or encountering people with who might vomit. And this overlaps quite a bit with OCD presentations, but it can be quite debilitating for some teens, to the point that they feel petrified of going to school, for fear of having to face that situation or experience stomach discomfort and having the uncertainty of whether or not they might throw up. There's also, I guess, related to that, panic disorder, where kids fear experiencing the physical sensations of anxiety and worry that they might panic in front of their entire class, or that they might feel so uncomfortable that they can't stand it. So they might avoid school. And other types of OCD presentations that might lead to school avoidance are fear of contamination, so whether it's germs. And as you can imagine, even in the hybrid models this year, we were seeing a lot of kids who were fearful of attending school for fear of contracting COVID or spreading COVID to their parents or grandparents. And I think that just compounded a lot of the fears of getting sick in the first place. Um, Away from anxiety, we also have many teens who might avoid school because of depression. So they might have low energy or low motivation. They might feel they can't get out of bed in the morning, or might not find reasons that school can be something that can make their day better. So depression can certainly be part of this picture. So can executive functioning problems, as we'll talk about later. Kids with ADHD, for instance, might have a lot of difficulty planning their work or sitting through days of class. I was working with one teen this past year who really struggled with making it through her Zoom classes that were sometimes an hour and a half or 2 hours long. This just having to keep her attention focused for that period of time was excruciating for her. And so she would kind of check out mentally, even if physically she was there. Um, and then finally, we very often see what we call psychosomatic symptoms, or physical manifestations of anxiety or depression that make it difficult for kids to attend school. This often looks like headaches, stomach aches, or just incredible fatigue. I've worked with lots of teens who just cannot get out of bed in the morning if they're facing the emotional uh, toll that anxiety and depression takes on them. And so they end up sleeping in and missing part of the first day, and then getting themselves into a cascade of avoidance that makes it difficult to get back. So as you can see, with so many different types of presentations that these kids can show up with, we want to be very careful with our assessment to make sure that we're fully understanding each kid's individual picture. School refusal or school avoidance itself is not a psychiatric diagnosis. As we just reviewed in the prior slide, it tends to be diagnosed in one or more of those ways. And that said, we want to understand the underlying factors that are contributing to an adolescent's avoidance so that we can design a treatment that's going to be more likely to help them. And tools that psychologists, psychiatrists, social workers, mental health workers use include diagnostic interviews. So there's, for example, something called the anxiety disorder interview schedule that's very well studied, that helps you really have a full assessment of a kid's symptoms. There are many questionnaires that we might give kids and their parents and teachers. And one of the most common ones to assess school refusal is the school refusal assessment scale. And that is a scale that was developed by Chris Carney, who's one of the major researchers in the area of child and adolescent school avoidance. And he broke down 4 different factors in the school refusal assessment scale. So there's teens or kids who avoid fear or anxiety produces situations at school. So those are the ones that are like socially anxious, generally anxious, OCD, fear, having phobias. Avoidance of aversive social or evaluative situations. So again, social anxiety. Attention seeking behavior. So these might be kids who, for one reason or another, feel they need to have people giving them more support and feel like they don't have another way of getting that support other than to start to act out or avoid school. And then finally, the pursuance of positive, tangible reinforcement. And that's a long way of saying that kids just want to be able to get something out of not going to school. So that might be like being able to stay home and play video games or do something that they would rather do instead. Maybe go hang out with friends if that's a possibility. So in the work that I've done with teens who avoid school, I think that there is a lot missing in the ways that we have historically been evaluating factors that contribute to the avoidance. So what I'm going to do next is review the risk factors that have been shown through research and through clinical anecdotal evidence to be a significant problem for these kids. And then we're going to talk a lot about how we would target these particular factors through treatment. So the first set of risk factors are those that are internal or very specific to the adolescent, him or herself. And one of the most common risk factors that you might see is a cognitive style or a thinking style in these kids that is characterized by rigid thinking, distorted thinking. So for example, these kids tend to have a very strong all or nothing orientation. So things are either great or they're terrible. I'm either a super success or I'm a failure. Or magical thinking, sort of like setting aside the reality of the situation and just like assuming everything's going to be great. So some examples that I hear a lot is like, all right, fine, I'm, the week's over, I'm not going to go to school this week, but I absolutely will be in school on Monday, as if something's going to magically change over the course of the weekend to make Monday easier. Tends to be the opposite, that Monday is quite difficult. I've definitely had teens who are like, oh no, I slept in, I missed first period. What's the point in going at all then? Without really thinking through that actually there's a lot of class left in the day and it might make it easier to stay caught up in school than to miss an entire day. I also see a lot of catastrophic thinking in adolescents who avoid school. So just believing that the worst will happen if they go, like I'll feel so anxious in class, I won't be able to handle it. Or if I take that test, I'm going to fail it. My teacher's going to think I'm dumb. And similarly, mind reading errors, especially for the socially anxious set. So belief that like everybody's looking specifically at them in the hallway and judging them harshly. Or oftentimes what happens in adolescents who avoid school is like, as they're missing more days, they actually do get a lot of questions from other kids about like, oh, hey, where have you been? And then teens start to fear the questions that they're going to be asked and then read into it that it means that those kids are judging them or thinking there's something weird or strange about them. So lots of distorted thinking, a lot of rigidity. Related, as I was mentioning before, there are a great deal of executive functioning weaknesses in kids who might avoid school, and there's a great deal of overlap between kids who have ADHD and kids who have anxiety. And that's often because there are lagging skills, so limited problem solving skills, for example, or planning skills, difficulty seeing the big picture, or tying current behavior to future consequences. So at the moment, it might feel not so bad to be procrastinating on studying for a test, but and not tying that to the fact that then when the time comes you might panic because you feel like you might fail. Or I've often seen like teens just thinking like, oh, I can't do this work now, but like I'll make it all up next week, without even thinking about what next week's activities or schoolwork might be like. So often sitting down, and this happens for college students as well, like making sure that they daily checking in with what's on the docket so that they're not forgetting about a term paper that may be due later, that they're going to have to spend a lot of time on. So they have to use their time today on work that's current. And as you can imagine, that overlaps with learning disorders as well. And kids with learning disorders are at greater risk for school avoidance, in part because they don't have the supports that they need. They might not have supports that they need in school, or they might be undiagnosed. They might struggle with certain subjects, and that can create a lot of discouraging feelings for kids. Next, there's a subset of teens who avoid school who have a great deal of emotional reactivity that makes it all the harder for them to be there. So these are teens who are probably very quick to react to stress, and their reaction is excruciating, that they might panic or that they experience a wave of dysphoria, and it hangs out for a while. It's difficult for these teens to come back to their emotional baseline, in part because they're wired that way, and over time have learned that their avoidance tends to make them feel better, at least in the short run. But these are also kids who don't have great distress tolerance abilities, so like it's tough for them to sit with distressing feelings, and it's hard for them to regulate their emotions. So as you can imagine, being in school can be quite triggering for these kids, and might lead to avoidance. And as I was mentioning before, kids who are prone to headaches, stomach aches, or other somatic issues are at risk for avoiding school, as are those who have lower motivation or desire to be in school, in part because they're feeling depressed or they have a poor connection to their school environment. There's a whole host of factors that are outside of the adolescent and yet interact quite a bit with an adolescent's internal experience. So I divided these into three categories just to give you a sense. These are hardly the only factors that can come up, but oftentimes we see kids who have academic stressors that make things difficult. So upcoming exams and worrying about those. I've often had teens I've seen who avoid school in part because of one challenging teacher. They just fear going to this one class because the teacher might be hard on them, or just to have a stricter style that makes it more difficult for the teen to do well in the class. Poor grades, in some school districts, there might be limited school resources or support people for them. And then for kids who have a lot of evaluative concerns, oral presentations can be a stressor. There are also social stressors. I've worked with a lot of kids who have had an argument with a friend that they identified as a really important support for them, and then that's enough for them to make it feel like it's too difficult to get into school the next day. Or there might be shifts in peer groups that make kids feel excluded, or unliked. These kids might have few friends that they can identify as supports in school. And in extreme cases, there may be instances of peer victimization. So that can include cyberbullying. And for those of you who work with teens or have teens, you probably are well aware that there's an increase in um, instances of like asking kids for pictures that might be compromising, and spreading those pictures among friend groups in ways that then can come back to be really hurtful to teens and make it very difficult to face their peers when they go back to school. And then finally, there's a whole range of family dynamics that can feed into the school avoidance cycle that we'll be talking about in a bit. This can include parental accommodation of avoidance behaviors, or parents like do a whole bunch of things to try to make their kid feel more comfortable, all in hopes of getting their kid to school. There may also be parents who have really high expectations of kids, or kind of stuck in their own thinking about what their kids should be doing or shouldn't be doing. Um, Families maybe that have higher conflict or criticism are more likely to have kids who avoid school. Um, and then other dynamics that can come up is an emotional over-involvement. So as you might imagine, as kids are avoiding school more and more, parents feel like they're not doing a good job. And so then they become more invested in their kid going into school. And then as their kid's avoiding school, they can take that very personally or feel desperate in ways that then leads to that conflict that can sometimes just make it all the harder to get in. And then on the flip side, there are families where a parent is either absent or uninvolved that can make it more challenging for teens to attend. So a third set of factors are this is, I won't get too technical here, but this is like the learning theory piece of it. So the reinforcers in the short term of school avoidant behaviors. I drew this out just so that you can see what it looks like, because if you are fearing school and you attend school, you're going to experience a high level of anxiety. Or if you're feeling really unmotivated and depressed, you might go to school and feel even worse. So what happens is kids have that high level of anxiety, make the choice to avoid, and then feel better. And that is so reinforcing, even if the next day they have to face the very same situation again and their anxiety spikes right back up. And so, what kids learn is that in order to feel better, they can avoid. And that pattern repeats itself again and again until the kid has learned the lesson that the situation is so distressing or challenging that they can't handle it. And then the anxiety starts to mount whenever they have to face the situation in the future. Other potential reinforcing factors are extra attention or support from family members or school staff, particularly for kids who feel like they need that extra support or historically haven't gotten it. And as I was mentioning before, there are some kids who find it reinforcing to engage in preferred activities. In my practice, and those of my supervisees, that tends to be kids who are very anxious, and it's just another form of avoidance. So if you're playing video games, you don't have to think about that term paper. If you are sleeping, you don't have to think about the oral presentation that you have to give the next day. And then finally, there are a set of long-term maintaining factors to keep in mind. So these are the patterns that develop over time. So if you are isolating yourself, sleeping a lot, staying at home, not interacting with activities or friends, that can just build into a major depression, which then feeds back into the isolation and inactivation and creates this vicious cycle, so to speak. Similarly, by avoiding school, it reinforces the idea that school is a dangerous place, which just increases anxiety over time. And the more anxious you feel, the less likely you are to go to school, and then the less likely you are to be disabused of the notion that you can't handle it. As we were talking about before, as parents become increasingly anxious and stressed, it increases the conflict and over accommodation that they might be engaging in an effort to cope with the situation or to try to manage it. And then finally, as kids are avoiding more and more school, there are the real consequences of having missed a, a trimester or a week or what have you. That could include having to repeat a year, having to be involved with truancy officers, not feeling or sorry, failing classes or not passing classes, and only increases stress and then feeds back into those cycles. So what can we do? Well, first I want to show you some research that's been done so far on the best psychosocial treatment we've got going for school avoidance, which is cognitive behavioral therapy, or CBT for short. And the studies that have been done, I'm just highlighting a few of them, but these are the ones that are probably the biggest or most innovative so far. So there was a study a while ago of individual weekly CBT with 63 anxious and depressed adolescents over the course of 8 weeks, which showed improvement in anxiety and depression, but frankly, no significant improvement in school attendance. So it did increase slightly, but wasn't as much as you would have imagined. And that said, as someone who works with this population, I'm truly not surprised that 8 sessions total didn't increase school avoidance because of the complexity of the problem. But at least it was like a start to see like, okay, what components here are going to be useful for anxiety and depression that might lead to improvements in school avoidance over time. And then that influenced some later studies that are more well, I guess more intensive and also more individualized for the issues that teens are presenting with. So I know David Hain did a study a number of years ago. It's preliminary, just 20 adolescents randomly assigned to one group or another. And they received 10 to 14 sessions, some of which included parents. And it also included optional modules on like increasing independence or addressing depression and also tackling family communication. And this study did show an improvement in school attendance as well as improvements in anxiety, which is great to see. But as you can also see by those numbers, half of the kids were still not attending school regularly by the end of those 10 to 14 sessions. More recently, just this past year, there was a Danish study that's looking at modular CBT in particular. And what modular means is just like picking and choosing the components that are going to be likely to be effective for a kid. And even though this is, again, a preliminary study, it's shown to be more effective than what we've had so far in addressing school avoidance and increasing school attendance, which is promising. I won't go over this in great detail, but there is also a lot of evidence to suggest that intensive CBT is especially useful for anxiety disorders. What intensive CBT means is instead of doing these weekly sessions for 50 minutes and assigning practices in between, you're having teens and potentially their families come in more frequently or perhaps for longer periods of time. So you might have kids come in for, say, an hour and a half each day for the course of a couple of weeks to really, really solidify these skills that they need to be successful. And this could be done in a residential setting in some instances. So there's a great program called Mountain Valley in New Hampshire where they have kids stay for usually 2 months to work on their anxiety. Or this might be done on an outpatient basis, like the program that I used to run at MGH, where we'd have kids come in for 3 hours each day. And what this allowed was a lot of the therapist guidance, even with being able to begin to go back into school or face school situations. And oops. I think you can imagine some of the potential benefits of intensive CBT, especially for a complicated issue like school avoidance. It can lead to more rapid symptom improvement. So because you're kind of condensing it in a short period of time, but that also means you're having a quicker resolution of some of the impairments that come with adolescent school avoidance and therefore less overall disruption in normal development. For families who live in rural areas, like for example, rural Maine, we had people come down to MGH to do the treatment. It allows them to get a full course or dose of treatment without having to use telehealth, although now telehealth is something that's become more and more popular and has increased access as well. The intensive treatment can increase session time, which allows for more therapist-assisted exposures. I'll explain what exposures are in a minute, but that helps to create more momentum. And then by doing the intensive treatment on an outpatient basis in this condensed way, it might circumvent the need for a higher level of care. So when planning out a treatment that's going to be especially helpful for teens to avoid school, you want to go back to that list of risk factors that I went over and identify the ones that are showing up for the particular kid you're working with. And then you want to match each of those factors to an appropriate intervention. What I mean by this is like not all kids are going to look the same. So you might have a kid who's super motivated to get back into school, in which case you don't have to try to enhance their motivation. Or you might have a kid who has no trouble with depression, so you don't need to do things like behavioral activation to improve their mood. So you want to really think about who the kid is that's coming to work with you, and then set reasonable goals for the treatment, and keep in mind that that doesn't always mean a full-time return to school, especially for kids who haven't been in school for months. The goals for this course of treatment might be to get them into school for half days or for some days and then work from there. What I've outlined here are the types of things that you would be doing in CBT to help adolescents who avoid school. But these are exactly the interventions that you are going to be picking and choosing based on the risk factors that they're presenting with. That said, nearly every kid and family that I work with who's coming in for school avoidance begins with getting a lot of education about how anxiety and depression show up, like how it maintains over time, and then also how school avoidance can begin and how that's maintained through the vicious cycles that I was talking about before. Without having a common language or framework to understand the problem, it can be really difficult to move forward with some of the other things that you want to be doing. And so then what you might be doing is trying to enhance the adolescent's motivation. And from there, you want to teach the skills that are going to be most useful. I won't go through all of these in detail, but for example, if you have a kid who's staying up until 3 o'clock in the morning on video games or Snapchatting or whatever, and then they're having trouble getting up in the morning to go to school, you're certainly going to be doing some work on getting their sleep under control. So in doing some sleep hygiene, or if they're having a lot of anxiety about going to sleep, then giving them relaxation training. But that might not be something that you need to do for everybody. Similarly here for the kids who might struggle a lot in social situations, not just because of anxiety, but because they frankly have struggle with like maintaining eye contact or having conversations, you might do some social skills training with them so that they have the skills that they need to interact well with kids at school. I can't think of a kid who has not benefited from being able to identify and challenge some of the unhelpful thoughts they have about school. So that's almost certainly something that would be included in the cognitive behavioral treatment plan. As we mentioned before, there's a great deal of distorted thinking that comes into play here. And as I'll be talking about in a moment, parent skills training may be really helpful, especially for parents who feel at a loss of how best to help their kids move forward. Exposure therapy is, which many of you have probably heard of, is incredibly important if there is an anxiety component here. So what exposure therapy means is facing feared situations without avoidance of any sort. And this is typically done in a gradual fashion, often because teens won't allow it to occur otherwise. So starting with something that feels manageable, like it could be walking around the parking lot of the school for 20 minutes, all with the goal of gradually getting the kid into the school building. So you're decreasing avoidance, and chipping away at it to help them relearn that they can be in school without it being incredibly aversive to them, or that they can handle it, or that it's not as bad as they expected. And so you are going to repeat those exposures over time until you have accomplished the most feared situation, which is often attending class all day. So that should give you like a taste of what CBT looks like. And I'm especially stressing the modular component of it because I think, and studies are starting to support this, that by individualizing treatment in this way, we will improve the outcomes. We will improve the chances of kids being able to return to school full time because we're meeting them where they're at and giving them what they need instead of a one size fits all set of strategies. After delivering this treatment, whether it's in a typical outpatient setting or in a more intensive setting, it's not like you're wash your hands of it and you're done. There's a lot of work that needs to be done to maintain the treatment gains. And oftentimes that includes what we call booster sessions, where kids are coming in for a period of time to maintain their skills, hone their skills, apply their skills. Um, this may also include pharmacotherapy. Many of the kids who've reached the point of not attending school are already on medications or already have either psychiatrists or primary care doctors who are prescribing. And so you want to have them maintain that treatment for a period of time as they gain their footing returning to school. Um, Other recommendations we might make include family therapy or group treatment. And again, this is all in the service of trying to meet the kid where they're at. In the intro, so I realize I have about 15 minutes left, and many of you maybe, well, I'm guessing a lot of you are parents and want to hear a little bit about what strategies have been empirically supported to help kids with anxiety and depression. I'm going to go over two that I think are crucial to know, and there I can share resources of where to find this. This first um, strategy is drawn from something called the Supportive Parenting of Anxious Child Emotions Protocol, so the SPACE protocol. This has been gaining popularity like wildfire among child psychologists and mental health workers, because it is designed specifically to work with parents whose kids don't want to or can't engage in treatment. Um, and it's like across the age range, so like from young kids through adolescence. And Ellie Leibovitz, who's the developer of the treatment, recently released a self-help book, or a parent help book that is based on this protocol. The idea here is that parents have to work on finding a balance between either overprotection or, on the flip side, excessive demands. So it's like a push-pull um, dialectic. So, on the one hand, if you're overprotective, you might say, "Don't worry, you don't have to go to that party this weekend, that birthday party, or I'll get you out of this or that, or if you go to school, I'll pick you up at noon. You can call me 20 times a day," and all that's all in the service of trying to help the kid get to school, but might be increasing anxiety over time as the child is unable to learn that they can handle the situation on their own or face difficult situations. But on the other hand, there may be some parents who are like, tough luck, you need to go to a full day of sports today, no matter what, or I'm no way you can ever have a mental health day from school, because we don't believe in that. So pushing harder than what the kid can do can sometimes overwhelm the kid and push them past the skill level that they have at the moment. So what's in the middle is developing supportive statements that can be delivered to the kid that balance acceptance and validation of the child's emotions and their experience, plus instilling confidence in the child. So that combination equals support. So an example for this might be like, you know what, I get it. Going to school after a long weekend is really scary for you. And I know that you're a brave kid and have a lot of skills to be okay today. Was kind of combining that and delivering some of that confidence while also not invalidating the child's experience. And so then the second piece of this SPACE protocol is trying to break down the cycle of over accommodation, which then increases dependence on parents and reduces the child's ability to cope or belief that they can cope. So parents are led through a series of exercises where they map out all the ways that they may be over accommodating, and then parents choose or go through the list sequentially in order to set limits on each type of accommodation. So a great example of this would be a kid who calls their parents, like, again, like I was saying before, 20 times a day for reassurance, or texts them, which is far more often than calling, truthfully. And the parent is recognizing how this is just reinforcing their anxiety and their avoidance of school. So the parent may tell the teen, like, listen, I totally understand that this is scary, and I believe that you can handle the school day with fewer calls. So I want you to know that today I will accept 2 texts or calls from you, and otherwise I won't be picking up or I will not be returning your text. And paired with this strategy is a lot of praise and rewards as the kid is able to tolerate or move through those limits. And I didn't put it here, but another big piece of the space protocol is finding other supports who are essentially delivering the same sort of message to kids, and that is certainly going to include some of the school personnel for school avoiders. So that might be like the school counselor, adjustment counselor, trusted teacher, etc. So that's the first of the strategies that I wanted to highlight for you. The second strategy that I think is just really useful for these multi or like these complex cases are is drawn from collaborative problem solving. It has a couple of names. Think Kids is the program at MGH right now. Um, and this program is a family treatment that does include the teen or the kid, and the idea is that there's 3 different approaches to managing challenging kid behavior. There's plan A, where parents are imposing their will and just saying like, I don't care, you got to go to lacrosse today. There's plan C, where parents kind of pick and choose their battles, and they might say like, you know what, if you're not going to brush your teeth in the morning, that's on you. But plan B is sort of the skill building piece, and it involves problem solving between parents and kids together. And it's specifically designed to tackle a kid's lagging skills. So if these kids, as we were reviewing before, are prone to cognitive rigidity or trouble planning ahead, by helping them engage in this problem solving process, you're also modeling and teaching these important skills. And so parents are taught to target the problems that repeatedly occur, preferably in advance of when they're occurring, so that emotions are not heightened. And there's 3 steps that are involved. The first is delivering empathy or validation combined with really truly understanding the child's perspective. Then there's a gentle sharing of the parent's perspective. And then there's the invitation to problem solve. So what empathy and validation might look like is saying, you know, I've noticed, Alex, that after the weekend, it can be really hard to get into school on Monday. Can you tell me more about that? So you're showing that you can see that what the problem is, but you're also showing that you really want to hear about it. And there's a set of skills that you would use while listening to the child's experience that show that you're listening and that you're hearing them. So that might be like reflecting back to them what you're hearing. It might be asking them questions to try to gain more information about their thoughts and feelings. And once that's had, the next piece is to share the parent's perspective. So it might be something like, you know, I hear you. It's after a long weekend, you haven't gotten a lot of sleep and you're feeling really exhausted on Monday morning, and it makes it harder to deal with your anxiety. On the other hand, I'm noticing that on Monday mornings, it can be really tough for mom and dad to get you out of bed and to school, and it's been leading to a lot of arguments between us. And then finally, invitation to problem solve. Like, I'm wondering if we can put our heads together and come up with a list of ideas of things that we might try to make this problem easier. And then they brainstorm and select something that they would all be willing to give a shot. I'm making it sound easier than it is. I understand that it's not always that easy, but there are strategies to deal with challenges that might come up. Lastly, I want to talk about the importance of working so closely with schools, whether you're a parent, you're a clinician. um, School avoidance is a school problem, and without that tight collaboration, you may be missing a lot of important pieces. And you know, as a therapist myself, I also know I can't be in the school all the time, even if I'm doing intensive work with the kid and like, help them face being in the school. I'm not there if the kid is having a challenge in the middle of the day and really needs some help with their skills. um, although teens seem to find me anyway by trying to text me over and over again. And then I use strategies to limit accommodations. See, it all comes full circle. But hopefully, you're working with school counselors as well to help them limit accommodation while also being appropriately supportive. So I like to find one point person, the person whose either job it is or the person who works best with the teen, and make sure that they are involved in developing the treatment plan. So I've had really good working relationships with adjustment counselors or school counselors who communicate closely with me and who I make sure I touch base with sometimes weekly or multi-weekly in the beginning. And this might also include a special education team, especially if a 504 IEP plan is being developed, or if there already is one in place, making sure that it's appropriate for the child's needs. So, lots of contact, especially even before beginning the treatment, getting a sense of like what's been done so far to address the absenteeism. And one really dramatic case that I can think of, it was like chasing the child around the school or as he was panicking and unfortunately calling authorities to come and manage his behavior, which only increased his anxiety over time. That's sort of like a nightmare case, but if you're hearing that, then you want to be sure to be giving a lot of education to whoever the point person is at school to make sure that they understand how best to manage child anxiety, even if it comes to a fight or flight reaction due to panic. It's also important to understand what the structure of the school plan is or what the restrictions are, because you don't want to propose anything that's just not feasible or possible given the school environment. So also, after you have successfully made your way through a modular cognitive behavioral therapy, you also want to be sure that they're continuing to do some good work in school. And so I'll often talk with school counselors about how they can facilitate exposure work in school. Like, for example, a kid who has a phobia of hearing about anything having to do with blood or gore, if they keep trying to leave class whenever they think they might be talking about war and history, then the school counselor might really help them gradually face that situation, or they might read some of the material in their like one-on-one meetings to get them to a point where they can hear it in a group, and so on. And then also making sure that the school isn't like overly accommodating, like allowing the child to just like piece out of their school classes 100%, but finding some sort of balance between being encouraged and giving some confident support to kids and remaining in school, or setting the same sorts of limits that I was discussing when talking about what parents might offer. Um, I try, like, even after a kid is doing super well and I might finish with their treatment altogether, I let the school know that I'm happy to remain a consultant to them if they need that. Just if questions come up or if they start to see any slippage, then I can also be in touch with the family to offer booster sessions. And lastly, I'll just highlight a couple of things to also be paying attention to when working with schools. One of the biggest challenges working with school avoidant youth of all sorts are school vacations. So you may be doing amazingly well, and then April vacation happens, and you have this whole week of kind of opportunity to get back into your old mindset about what it is to go back to school. And so I'm really careful to have kids come in for sessions during those vacations if at all possible. I encourage creative programming. So, like, if there's something happening at school, I mean, I know it's in COVID times, this is a lot more challenging, but in typical times, like if there's a volunteer opportunity at school or some way for them to remain connected on the vacation, I'm a huge proponent of that, to keep them kind of in the mix. Or if that's not possible, even just going to the school and like driving around the parking lot can be really useful. You also want to keep an eye on like what's happening in the school environment that might be contributing. So, if a kid is reporting peer conflict or bullying to me, I'm sure to have that conversation with their permission, with the school point person, so that the school can use what protocols they have in place to address it. Similarly, if I suspect that there's an undiagnosed or poorly accommodated learning disorder, I will advocate for school testing or outside testing to try to get a better handle on what will work. But ultimately, and I hate to end on this note because we can get kids back into their school programming, but if despite all of our best efforts, we're just not there. There are some amazing programs that have been developed within some of our public schools that are specific to kids with significant anxiety and depression that are designed to help them, get the education that they need, get the support that they need outside of the mainstream classroom. I think often with the goal of improving their ability to eventually enter the mainstream classroom. But that aside, it may mean that it may be that therapeutic school would be more appropriate for some kids who just cannot get back into school. And that might be supplemented by a tutoring program. And then, there are many kids who ultimately opt for online schools or homeschooling programs. And especially with the pandemic, those have just proliferated. So there are options for kids to get education, even if they're not quite ready to be back into school full time. I will end with two great resources. The one on the left is for parents. It's a workbook that steps through some of the skills that we talked about today. Both of these are Chris Carney books. So When Children Refuse School, that's the one on the left. The one on the right is Chris's book for school-based professionals. So if you work within schools, that can be useful. And that said, in our area, in the Boston, Mass area, we do have some great CBT programs. As you might imagine, we tend, not just the Concord Center, but many of the programs that provide this treatment tend to have wait lists, which I know is discouraging, but I would suggest that you get your kids on the wait lists at these types of programs if possible, if you are interested in this type of treatment. Because it's better to be proactive and have them there on the list when you need them in the fall, for example. So I am happy now that we're at the end to answer any questions post treatment, or sorry, post presentation. I know we're out of time right now, but I am happy to answer any questions that you might have. My email is on the website that Matt shared before.
Awesome.
Thank you very much.
Thank you, Jamie. And yeah, there are a bunch of questions, and I know we're kind of out of time here. So I wonder if what I can do is take those questions and in the follow-up email, write a response, unless you want to try to.
Yeah, no, I think that's a great idea. If you can send me the questions that I don't have access to the chat right in front of me, but like if you can send me those questions, I will write some responses, send them to you, and maybe you can send them out to folks.
Okay. Would be awesome. Thank you again. This was very, very informative. And thank you everyone who joined. And I hope everyone has a good rest of their week. And you can be looking for answering the chat and talking at the same time now. You can be looking forward to my follow-up. Hope everyone has a good day.
Thank you.
Thank you.
Catherine, you can, if you're still there, you can email me. I probably have a bunch of other names also. So my email's in the chat if you want to reach out, and I probably have a list.